So what's so different about using SkinCeuticals 3-step advanced neck treatment for saggy skin and neck wrinkles?
Different. So we do test on human skin, and we also do a lot of our clinical studies pairing with other doctors, doctors that do Kybella, doctors that do cool sculpting, doctors that do laser.
I was invited along with some peers to have a Zoom call with a SkinCeuticals product knowledge educator named Gretchen and learning about their advanced neck treatment products and protocols. So we're just going to get right into it. So step one is revitalize. That's using the tripeptide-r neck repair. It has a 0.2% retinol to help decrease crepiness and speed up and increase skin cell renewal rate. So this has 2.5% tripeptide concentrate, and this helps increase the skin's elasticity. It also has the, so you want to put a couple squirts, 5% glycine, and glycine helps the firmness of the skin by inhibiting the breakdown of collagen. So these two are complementary products. So glycine actually is the main component of that, is also in a lot of cellulite creams because it helps firm up the appearance of the bumpy skin. Now these pictures here were taken from the SkinCeuticals website of before and after 16 weeks of use. And so what they informed me was they did not take the most wow picture of all the pictures that they were taken. They actually took the average, so the average appearance or the results, so that it managed the user's expectations of what they can expect for their skin. So the average user said that they found 27% improvement in crepiness, 16% improvement in firmness, 16% improvement in elasticity, and 16% improvement in neck lines. 13% improvement in skin sagginess, and 23% improvement in skin smoothness. So here comes the pro tip. It says to use it concentrated on your neck, but your neck and your chest have very thin skin. So you can also apply it all across your chest, especially if you are starting to see or you want to prevent the Longer's lines. So that's basically the vertical lines that go down the chest. So you can also apply this whole treatment to the treatment of your neck and your chest. I do have to emphasize too, though, those of you who have sensitive skin or you are prone to sensitivity, this may not be suitable for your skin. So this is the tripeptide-r neck repair. So I was a little apprehensive of using this because I cannot use Retin A and a lot of retinol based products. I get hives, I get a rash. So I was very apprehensive. But Gretchen from SkinCeuticals said because of the vinyl dimethicone that's in here, it encapsulates the retinol, and so there is a slow time release. So I did a little test patch behind here, and just to see, and the next morning I started peeling immediately. So even though she recommends doing it 2 to 3 times a week, and for people who have severely thick sun damaged like leather skin, you can even work your way up to doing this morning and night and almost every day. I cannot do that. I probably would have to stick to once a week and then slowly working up to twice a week. So step 2 is restore, and so we did revitalize, and now we are doing restore, and this is the triple lipid restore 242, and this helps improve the tolerance of the retinol. So you want to layer this on top of the tripeptide neck cream that has the retinol in it, and it helps restore the barrier function of the skin. This has a good balance of, so if you look at the 242 here, this is the 2% ceramides, 4% cholesterol, and also 2% fatty acids. So it's also very, very good if you have lipid poor skin or extremely dry skin. This may not be recommended for people who are breakout prone because your problem isn't oil, it's usually water. So this is step too. So SkinCeuticals actually recommend starting off slow if you are prone to sensitivities or have never used retinol, but this helps kind of neutralize and helps reduce that inflammation and peeling. So for example, for the evening, you want to use the tripeptide-r neck serum first. That's the first step. And then you want to layer it with the Triple Lipid Restore 242. Now, before we get into the next step and then also some alternative options for those of you who are not really sure how to use this and in what correct order, and you're thinking about buying it, please go ahead and give us a thumbs up if you're finding this information helpful. Hit that subscribe button if you haven't hit subscribe to our channel, and of course hit that notification bell to see when our next video is up. Okay, so we're moving on to step 3. So this is the third step. It is an optional step, but the SkinCeuticals rep really recommended this. This is the AGE interrupter. Okay, so this is a cream. And AGE stands for, if you don't know what this is, it's Advanced Glycation End Products. And I do talk about it, and I'll put a link right up there for what exactly that stands for and what it is and what it does to your collagen and elastin and the aging of the skin. So this really helps with the sagginess of the skin and crepiness. There's 30% proxylane, which helps restore the water to the skin. There's 4% blueberry extract, which, as most of you know, it is an antioxidant. And then there's 0.2% phyto, and that helps restore the barrier repair process. So that's this one right here. And if you, it's kind of greasy, but here is the cream right here. So here are some alternative options that you can do. So in the morning, what you can do is, if you're using the SkinCeuticals CE Ferulic Acid Serum, you would put this on first directly on the skin, and then after you can layer with the Triple Lipid Restore. And then after that, you can layer on top of that sunscreen. Now, here is the thing. When you use a moisturizer, you put a sunscreen on top of the moisturizer, it can dilute the sun protection factor. So if you're doing that, I would recommend using a very high SPF, like an SPF 50, because you're using retinol anyway with this that actually makes your skin extra photosensitive. So I would recommend the SPF 50 if you decide that you want to do that. So I did say that if you are using this, right, the recommended protocol is using this step first, then the Triple Lipid Restore. The alternative is, like I mentioned before, is adding that extra step where you use the AGE interrupter. So you would do that the first night. Then the next night, you would not use this one, okay? You would go into using just the Triple Lipid Restore 242, and you can layer it on top with the AGE interrupter. And then you can go back and alternate where you would use this again. And then you would use the Triple Lipid Restore 242, and then on top of that would be the AGE interrupter, and this is in the evening if you decided to do it that way. Now for someone like me that cannot use this every other evening, I would probably take the 2 evenings out of the week and use this, and just layer it on top of this, and then this is the recommended optional on top of that. Ultimately, the ideal recommended protocol is to use the tripeptide-r neck repair 3 times a week, and then followed by the Triple Lipid Restore and the AGE interrupter. This video was sponsored by SkinCeuticals, so if you have been wanting to try SkinCeuticals or you love some of their products, if you purchase $120 value of SkinCeuticals at the Skin store using this code go see Christy, all caps, then you can get a complimentary hyaluronic acid intensifier. So multi-weighted, multifunctional hyaluronic acid. And that, it may be a smaller size for that one, and the Phyto Corrective mask right here. So go ahead and you can put that link right here and the website as well. So this is a video that is sponsored. However, I will be doing a follow-up in several months once I finish it to give you the actual feedback on what happened with my neck, and you can actually see the visible difference. So remember, makeup is an art, skincare is a science.